good afternoon to everyone. It's lunchtime, so we expect to receive more people. So we are very happy today to have this chance to introduce yourself to the world of Daedalus that works at planet scale with purpose on the interoperability world. In terms of agenda, we are going to touch those approaches to interoperability across the world. So we try to take you in this trip or tour around the world and present to you different ways to do interoperability. And here the team with me. So just in order of appearance, Lapo Bertini, that is our Product Business Unit Director for Interoperability, Femi Ladega, our Global Chief Digital Officer, and finally, but just because he is the owner of the land for us, Damon Auer, the North America General Manager. So we start now. I will start with some introduction, and then I will hand over to the different colleagues, and we'll try to give you a flavor of what we do around the world. So let's start.
Awesome.
A very quick introduction on my side. Interoperability is just a buzzword because we listen, we read everywhere the word interoperability, and specifically in this setting is very recurrent. But it's not just a buzzword. In terms of healthcare interoperability, we have a long history behind us. So just to mention some steps, very long back in the past, the birth date of HL7, and then the IHE adoption, and then the FHIR appearance in 2012. So today we are here to talk about interoperability, but with a long history on our back. And in which way today the market is presenting, talking about interoperability in a very crowded way. So it's very difficult to understand the differences between the different players. And we understand it's very difficult for clients to understand how to identify the solution that best suits your needs. In our opinion, the key way to do it is understanding the use cases. So not approaching interoperability as a technical problem. The technical part will come at a certain moment, but is not the way to start an interoperability project. This is our experience. And our experience is very wide. Even though it's the first time we appear to the HIMSS event, we have a long history. We are present in more than 40 countries and implementing different solutions in different healthcare systems models. So not only one model of healthcare, but many. And we are a very strong technical team supporting us across the different countries, and mainly our job is to focus on the continuum of care, so providing solutions not only for the hospital, but for everything that happens around the continuum of care, from the prevention to the early detection, to the diagnosis, to the treatment, but even for the follow-up, the rehab, and the end of life in case. And we have dedicated solution that is exactly the solution for interoperability we are discussing today. So I'm very happy to enjoy, to wish you a very good flight through our countries, through our experience, and I will give the connection to Lapo.
Right, okay, thank you. Thank you, Sarah. So let's start from some place here, right? So we have a case which is very important to look at, and it's important because it happened during this awful pandemic. And it gives a sense of what interoperability can achieve if applied correctly. So what if an unprecedented pandemic hits you with no warning? And what if you need to react to a growing number of cases in your region, in your country? And what if human-to-human contacts are severed or reduced to a bare minimum. You had to stay home orders, and you can move people around, or suspicions that you have COVID or something like that. You have to go on with things you have. What if you have to go on with things you have? You don't have the time to put in place anything new. You have to deal with the things you have. What if? And on that question, the region Campania in Italy. Region Campania is the third largest by population in Italy, has some 6 million people, short of. And you may know this because its capital of Campania is Naples, and everybody knows Naples, you know. Pizza is coming from Naples, by the way. Okay, so just to give a perspective here. So the idea that they had is we have this severed human-to-human contact. We can't allow people to move as they were moving before, going from home to the general practitioner or to family doctor or to the emergency room. They couldn't do that. They had to stay home, and they had to be managed and assessed at home. So Regione Campania said, well, we need a system that is interoperable with the things we have. So we don't have the time to roll out new GP software. We don't have time to replace the laboratory information system. We don't have time to do enrollment by rolling out a new system to do enrollment. So we don't do, but we have leases in place. We have leases in places. We have GP that have their own computers. How do you do that? So they need to have a rapid establishment of an ecosystem to support the enrollment, the assessment, and the monitoring of patients that they had COVID. Enrollment, which are the candidates, the assessment, how do you feel? Can you do a self-assessment? And if he is positive, monitoring on the patient at home, so that soon that the symptoms are becoming worse and worse, you can act and go to the hospital. So the challenge for the customers was coordination of different pathways, mainly COVID, but it can be applied to any other pathway, scheduling of exam and test across the ecosystem, the monitoring of clinical parameters with an embedded rules language and alerting system. Bing, if something happens, I need to know it, right? And most of all, building on existing structure. So we place this E4H, which is Italy's flagship interoperability platform, at the core of this effort, by connecting all the stakeholders that were engaged, the patients with mobile apps and web apps, the healthcare sources and the GPs for the enrollment, the primary care providers for telemedicine, and the laboratory for testing and results. And all this will come in together into one single platform that allow to control, exchange, and follow up the well-being of the patient. So from a timeline perspective, we have candidates that are enrolled and that are filtered because, maybe for existing conditions, people that have pulmonary diseases are more prone to get worse, and they needs to be assessed more closely. Those are enrolled will be having a mobile app or can connect through the internet to a web app, and they can self-assess. How do you feel? Do you have the symptoms? Do you have this and that? The self-assessment questionnaire is going to primary care physicians for their assessment. They can say, okay, you are most likely having COVID, so I schedule for you a test, right? And so the patient can take the test, and that test then can be further used for other for follow-ups, right? So you can do telemedicining, telemonitoring of the patient once the patient has been confirmed that has conditions, You can inform the patient by sending out text messages, SMS messages. You can monitor and update the clinical assessment, and if need be, you have to escalate to the emergency department. So what are the benefits of the implemented process? Collection of assessment information from the patients and GPs, data processing via DC4H platform, request orders either to for lab exam or telemedicine monitoring, support the clinicians in the follow-up, receive exam results, monitor the patient conditions thanks to a centralized web visualization layer called patient synoptic, where synoptically you have all the information of the patients collected together. And the value for the stakeholder is immense. All the stakeholders are being connected in a unique platform, realizing an efficient network to exchange this information. All clinical reports and outcomes are managed in only one system. Some of them are available to download, saving time to patients and healthcare providers at the same time. And mostly, rollout of this project has been in 1 month. 1 month. From start to operation in 1 month. Because we leveraged what was present, but also we leveraged the technology that we have that have enabled this to happen. So, in the continuum of care, where do we sit with this project? Early detection and diagnosis, that's where we sit. So what are the value for the persons? This is an unintrusive process. So patient stays at home. Actually, I would call it a citizen before a patient, because you're a patient if you have something. So the citizen sits at home. This is a fast, remote managed, unintrusive process. So very much a benefit for him. For the professionals, for the clinicians, seamless connection to enrolled patient data. For the national and the regional healthcare systems, connecting all the healthcare structure and GP at the regional levels to cooperate on this. And for the society at large, better assessment and control of the pandemic, so that you can do this at much larger scale. And this project is not only being implemented as I described in Campania, but also in Apulia and in Sicily, exactly the same, 2 other regions of Italy for the same purpose, just to show how important it was to control the data and assess the data in that COVID situation. Okay, that's it. Thank you very much. I will pass on to Femi. Thank you.
Hello, good afternoon. I'm just going to take you through one of what I would say, one of the most exciting and largest interoperability solution that we've deployed around the world. And I guess a lot of you here kind of understand where India is and in terms of scale. So as I go through this, just think of scale, think of complexity, think of innovation. So there's a client that is very close to my heart, Apollo Hospitals in India. So I'm just going to paint you a pen picture for just 1 second. So they're the largest provider of health services in Asia. That's number one. Number two, just look at the numbers, just the sheer number of patients that they've got. They have 71 hospitals across India. And the objective really is to be able to coordinate care across all of those dimensions, from Chennai to Delhi to Calcutta to Bangalore. To just think of that entire geography. They have a very large retail pharmacy outlet, about 3,400 of them. And also the number of primary care clinics and the number of individuals that are served out of that, number of diagnostic centers. So this is just a sheer volume-based, event-driven architecture that we had to put in place. One of the things that really excited me the first time I engaged with this client is that their focus was very clear. It's really about transforming the patient experience in an environment that is fraught with a lot of challenges, right? Secondly, it's about really leveraging technology to drive innovation. And if you know, adopting technology within a single hospital is great. Adopting technology within a single clinic is great. But if you have to make that pervasive across 71 hospitals, hundreds and hundreds of primary care or ambulatory clinics, across hundreds and hundreds of diagnostic clinics, across a very large geography, it gives you a different perspective, right? So their objective is not only to drive a better patient experience, leverage technology, but most importantly, invert their IT organization in such a way that that organization can be responsive to the dynamics we find ourselves in our industry today. And when you meet a client that has a clear picture of digitization, a clear vision of leveraging data and AI to optimize care, this is an example of such an organization. So I'm just going to zero in on this slide. So our approach was very simple. How do you, as we said, a journey of 1,000 miles begins with the first step. So our approach really was to put a structure in place that would allow us to unlock the treasure chest of data within this client ecosystem. Like I said, 71 hospitals, 150 diagnostic centers, 3,800 pharmacy units. How do you bring all of that together? So the objective was to create a nationwide FHIR-based interoperability network. And that kind of allowed us to do four things, I would say. It allows us really to normalize data across a highly federated ecosystem. It allows us really to apply functional interoperability around those systems as well. But most importantly, it allows us really to create semantically linked data. So how do you harmonize these whole data sets together, not only from FHIR, but also convert FHIR to OMOP, convert FHIR to I2B2, convert FHIR to a lot of things, because that then allowed them really to create the AI or the analytics infrastructure to exploit this information. So that was what we did. That's the first thing. The second thing really is about optimizing that digital front door for the patient, where when you come in or you kind of book your appointment over the internet, on the mobile, or you have a walk-in service, harmonizing all of that across this ecosystem was also quite exciting. But we knew that in order to make that work, like I said, you got to unlock those data sets. So one of the first things we did was to API enable their EMR. And that was quite exciting because it meant that the historical data can now be brought into the mainstream of the enterprise. And so a lot of folks talk about interoperability, but just think about bringing encounter data with claims data, with supply chain data, with genomics data together in an ecosystem. That is what really makes this organization quite unique. And on the heart of that was a strategy that would say a separation of concern architecture model. One that says the systems of record does what it does well, but if you unlock the data into a digital platform, then you can derive a lot of value from that platform. And then you can then push that information into different channels. And that was the third thing we did. We enabled an AI-enabled UI/UX model, where the data that was once held in those systems of record are now visible in different digital channels. And what that allowed us to do is now have an enterprise that is fully digitized across the whole of India. So when you're talking of a health information exchange across a country of billion citizens, this is it. And it's a true event-driven architecture. Just to give you a bit of numbers, so across this ecosystem right now, supports about 32 million patients. over 20 million appointments. Just think of the volume of diagnostic, close to 200 million diagnostics across this ecosystem. We're talking of service requests, we're talking of medication, we're talking of procedure. The point here really is huge volumes. But underpinning all of this is the digital platform that Lapo just talked about as well, where we unlock the data, you have a large portfolio of FHIR interfaces underpinned by a FHIR gateway and a FHIR store, but we then make that information useful in AI and then wrap it out into a command and control analytics infrastructure. It kind of just gives you a pen picture of how to drive interoperability at scale that enables digital transformation, but also enables you to prime your environment ready for innovation. So now Apollo can innovate with or without us. They can build their apps garden. They can exploit the information for next generation insight. That is the power of interoperability. Thank you.
That was a good one. I always like listening to Femi. I get to talk about a recent customer of ours that's doing some really special things. So I appreciate your attention for the next few minutes. I'm going to talk about the Multi-Assistance Center. We refer to it as the MAC in Texas. And if you talk about interoperability for interoperability's sake is fairly boring. I think all of us here in this showcase at least have at least a handful of purposes, meaningful purposes that we are setting out to enable with interoperability at real country scale, the way that Lapo and Femi described. I'm going to talk about a purpose of orchestrating complete care experiences for individuals with special needs at the MAC, and I'll spend just a few minutes on these slides. You notice all our slides are a little bit different. I like Femi's, those are always good. Mine have more color. They're a little bit more whimsical. I hope we have some fun with them. So the Multi-Assistance Center is an idea that was born out of the brain of a guy named Gordon Hartman, who's a very successful entrepreneur in the San Antonio area of Texas. And he has a daughter who's now an adult, but when she was younger, and she's going to live with special needs her whole life. He has a daughter, and he thought to himself, man, I really want to create some experiences for her that can give her the joy and delight that others in her age group and social strata have. And he created this really cool amusement park experience for individuals with special needs. So it's equipped with wheelchairs that literally run on air and water so that they can run through fountains and things like that. It's a really cool thing. Google it. You'll have fun. And he named it Morgan's Wonderland. Morgan is his daughter. And he created this Morgan's Wonderland, I think 10 or 15 years ago, and they've continued to grow and enhance, and it provides delightful experience for literally at this point millions of individuals with special needs that can have a safe, fun theme park experience that all of us sort of take for granted, particularly here in Orlando. So one of the most recent innovations that they're adding to the campus at Morgan's Wonderland is the Multi-Assistance Center. So they're building a building. You can see a picture of it here. Actually, two buildings that sit side by side that will house local caregivers. So think of specialists and primary care docs, dentists, therapists, psychiatrists, behavioral health supports, all under one roof to provide a place for individuals with special needs in San Antonio and the counties around San Antonio, a coordinated, proactive way to experience the healthcare system. We all live in what I view as an unnecessarily, almost unacceptably impersonal healthcare system, and that's not okay even for us who have the ability to learn and navigate the system. It's even more difficult for a child or a family member, adult even, with special needs to navigate the system effectively. So the Multi-Assistance Center is being created to allow just that. They will employ a group of about 75 health navigators at the start, whose job it is to be proactive about understanding the consumers that they serve and helping them navigate the medical system, the therapeutic and behavioral system, and probably most importantly and uniquely in this particular case, all of the community-based organization supports and services that we can bring to bear in the community. So we have the privilege of being the solutions provider for software in this environment. So we are creating the Mac Navigator system that will give those navigators a complete view of the people that they are serving in that community, everything medical, behavioral, situational, preferential, fears, goals, objectives, delights for each of these individuals, and then organize the resources, orchestrate the resources of the Mac, the community, so that they can live their best life. You can see the mission here to improve the lives of individuals with special needs. I'll describe this in just a moment, because if you don't have, I think many of us have, but maybe not all of us, either have in our family or in a circle of friends or kids, classmates at school, we know individuals with special needs and the extra hurdle that that creates. And this is a support built just for them. So what is a special need? Is an individual of any age, so even though there's a bias towards making sure that we're taking care of our youngest and least well-equipped to navigate the system, the MAC service will be provided for individuals of any age with a special need in and around San Antonio. A special need is a long-term impairment, typically cognitive, sensory, motor, communication function. You can read it here, that substantially limits a person's ability to exist in society the way that the rest of us without those challenges likely exist. So it's clear to the MAC and representative in the model that they've created that no single organization, medical, behavioral, or otherwise, is in a position to really orchestrate care and experience for these people with special needs in the community. And so the MAC is setting out to solve what is a rather impossible problem. This is probably, well, it's in the top two. I think this one takes the cake for me as the most inspiring and most complete vision for whole person care, not just medical. And we're in the interoperability showcase, and a lot of us are talking about eliminating faxes and making sure that we can make medical records visible from one part of the country to another part of the country, which is extraordinarily important. But we have to remember that medical records only contain roughly, somewhere, it depends on who you talk to and who did the math, but somewhere between 20 and 40% of the information that actually identifies me as a person and the things that are most important to give me and make sure I get or do so that I can live my healthiest and best life. So you can see here some imagery that the MAC was kind enough to share of what is a very fragmented and for any of us, I think, a frustrating healthcare experience, but even more frustrating, difficult, challenging, and hard to keep up with for an individual with special needs or a family member or friend that is helping to care for that person. So on the left-hand side, you can see here putting those puzzle pieces together of community-based services that can have an impact, a medical home for the person, a therapy home for the person, and then persistent and proactive navigation services. Just like the other case examples that you've heard from my colleagues today, we're using our Daedalus Connected Care platform and ecosystem, which is underpinned by a product called Digital Connect for Health, DC4H. And in this case, a partner of ours that provides a very modern consumer workflow-based digital pathway management and engagement experience for consumers that we're serving called RX.Health. And by the way, we can go into a tremendous detail in our part of the Interoperability Showcase booth just over here. I think we're in the far corner. Look for data loose. Sounds like setting your data loose, and RX.Health. So the MAC Care model is what we are enabling, and this is a simple representation of that, which I've already described. One of the things that's fairly unique about this particular venture and the community is that there's an integrated community-based organization network that another provider, solution provider called Signify Health has underpinned that CBO orchestration in and around what the MAC will be doing, so we can use Signify as both a refer in-out, seamless, it disappears as far as the consumer, the patient, the individual with special needs is concerned. But a really important enabler for orchestrating not just medical and behavioral, but community-based services that we can bring to bear, sports, after-school activities, food and nutrition, learning opportunities, affinity groups, et cetera. And the doors for the MAC open later this year. We have a soft launch coming this summer. There will be a hard launch. If Gordon's history with the media is any lesson for us, this will be a big splash in October. Please do keep your eye out for it. In the meantime, if you're interested in learning more about the MAC Morgan's Wonderland, how you can either begin to tell this story in other parts of the show that we're at here and when we all disperse and head home, please do visit morganswonderlandmac.com. You'll see that here. And find a way to, at a minimum, tell the story because it's brilliant and impactful. And I believe we will have an opportunity over time to roll this model into different geographies in Texas and ultimately different geographies around the United States and perhaps the world. So we're privileged as Daedalus to be a solution partner, the solution partner for the MAC to bring this to reality, and happy to share it with you guys today. And we'll take any questions over in that corner booth.
Yeah.
Anytime you guys want to visit.
So the last case we want to introduce to you is another experience, interesting in terms of, let me say, impact on the society, and it comes from UK. So it's the experience of the North Staffordshire NHS Trust. The North Staffordshire is an organization, a leading provider of mental health in the West Midlands. So they are working from both hospitals and community-based premises, and they operate about 30 sites. They operate in a very deprived area with challenging care services for vulnerable children. The needs this customer had were about the difficulties of these children or these young people. So children were often referred to the wrong provider, and this was leading to delayed care and leading acute hospital intervention. So this was causing late detection of critical issues, ineffective use of limited clinical capacity, increase of waiting time for patients with more serious diseases, and really affecting this thing in terms of bad clinical outcomes. So the access to care was increasing in terms of demand, and they measured up to 4 weeks waiting for an appointment and 14 weeks for a treatment. And definitely the percentage of the referrals for children with mental health diseases were absolutely incorrect. So all these things combined with the demand for services absolutely doubling in the last 2 years make them thinking to some way working in a different way. So the project in the North Staffordshire, again, implements our interoperability platform, leveraging on what we call the 6 stages of value, but I'm sure Femi at the end will explain even better. So we think it's not only about integrating. Interoperability is not only about integrating. It's about integrating, of course. So in this case, we integrate multiple systems with the patient administration, including many external systems like the schools. So to have a broad view of all the information available around these young person. We do ingestion, so definitely to elaborate the information and to have these responsive patient engagement portal. We do indexing, so we persist the data thanks to Elasticsearch. We do insight, applying the technologies you see there, so Kibana and some things related to the process management. We inform, again, thanks to JBPM. And finally, we intervene, because thanks to all this information, we are able to integrate the questionnaires in the overall hospital information system. So the results are about analytics to plan the service provisioning, integrate the clinician and patient care plan, questionnaires integrated. At the end is a matter of providing the right care with the right provider at the right time. In terms of continuum of care, again, we are focusing between early detection of these mental diseases to diagnosis and to treatment, and the value we are able to generate for the different stakeholders are very relevant. For the patients, for the young people, it's very important to speed up the treatment. So the children conditions are better managed. Have the possibility to have a professional listening in a very short time is crucial. These young people need to have someone professional to talk about their problems. The second stakeholder, so the professionals, they are really reducing the number of unwarranted variation in the care for the care workers that are managing the patients. They have flex clinician capacity. They are not overburdening with unnecessary requests the overall teams. And finally, they have better referrals and improve data collection from the general practitioners that are connected to the system. For the other organizations, so for the NHS Trust, it's possible to redeploy the staff from the hub functions really to the treatment, because the process is smooth, the information are flowing well, there's no need to manual management, and so finally they can redeploy the clinicians, the worker staff to the real treatment and not just to manage the administrative things. In terms of the national and the regional care system, we have we measured a reduced number of referrals, so less pressure on the workforce. And again, from the society perspective, we can definitely agree that healthier young people defines a better society. Finally, we have a number of outcomes that I don't want to bother you now, but if you scan this code, you can go to our website and read the full use case through the real voices even of the client. So we have some interviews to the client that are explaining in which way this interoperability use case is really changing the way to provide the care to these young patients. I hand over for the final session to Femi.
Thanks so much, Sarah. So I'm just going to quickly paint you a pen picture of a number of lessons we've learned from these case studies. So I'll probably give you 3 things from my perspective, right? If you look at every single one of those case studies, 3 things are at play. How do we connect all of the stakeholders into this ecosystem? And once they're connected, how do we unlock the value from what they've got? And then how do we then optimize care as a result of that unlocked value? And the third really is creating that closed loop of collaboration. So I call it Connect, Care, Collaborate. Now, at the heart of it, that's what's at play. But guess what? In order for that to happen, there is a set of nuclear set of capabilities that you need. And that is what I have in this little box here, where you unlock the data to derive value, right? You unlock the data to not just only to push data, but to make that information actionable. So how do you then create insight via AI and things like that? And also, how do you, because I believe that for interoperability to be successful, organizations need to innovate with or without the providers of those interoperability capabilities. So how do we enable them to build their own apps garden? And this requires really the ability to have APIs that are exposed to make that a lot easier for users to do that. And I think the other one really is about semantic harmonization. We all have multiple dialects in our infrastructure today. Some only just do disease diagnosis around ICD, some around SNOMED, some around LOINC. You have all these vocabularies that need to be harmonized together. And if you bring all of that together, I think we can begin to touch the true value of interoperability. So that's at a business level. So let me just go down a little bit into a series of some technology capabilities that you need. I think we're in an age of what I call hyper-openness. If interoperability has to work, we have to follow this set of principles. And what are they? We all know. At the heart of interoperability is how do you trust, or how do you put a set of boundaries around that data in terms of accessibility? So privacy and confidentiality wrapped with true standard ways of exploiting that is really going to be key to that. If you look to the left of this picture, if we, with that privacy and confidentiality, and we talked about unlocking that data, I think the principle of open data has to be at the heart of what we do. Because if we can unlock that data, it's going to be easier to orchestrate the processes that you've just seen a few minutes ago. But in order for that to work, you need to bring that semantic harmonization. So open terminology is really central to this. And at the end of the day, right, how do we create economics of scale around all of this stuff? And that's why we push the context of open deployment, leveraging technologies like Kubernetes or things like where Docker or containerization becomes the currency of your deployment. And to the right of this picture is, if I have the base in place, then what's on stage? What's on stage really is I can expose the data as open APIs. I can innovate with new forms of AI and machine learning. I can create my new apps, right? And at the end of the day, we can create new forms of what I call user experience that our clinicians are screaming for today, solutions that actually allows them to carry out their work. So if truly we're talking about interoperability, these 10 principles of hyper-openness has to be at the core of what we do. So we're going to wrap up here. Do we handle questions? Okay.
Yeah.
So we're around if you guys want to ask any questions. We can get more into detail around this. And like Damon said, we've got a stand just behind you here where we can take you into the depths of what we've done. And we've got a stand at 675 61
6751.
Exactly.
51.
6751.
4 of us.
Yeah.
But we got it.
We got that. So 6751. So please come around. We are here to share our knowledge as well as help you through some of the challenges that you may have. So thank you.